Hello, I am Dr. Subroto Pal, consultant gastroenterologist, Kothari Medical Center, Alipur. Today we are going to discuss about a common problem of the common man, that is gastroesophageal reflux disease, commonly known as the GERD. It is also known as acid reflux disease or acid peptic disorders. It is caused by the reflux of acid in the stomach, which is coming out into the esophagus, causing burning sensation. It is a very much discomfort. Gastroesophageal reflux disease or GERD is caused by the relaxation of the gastroesophageal junction, that is the lower esophageal sphincter, that helps to come out of the acid content of the stomach into the esophageal mucosa, and which causes damage of the esophageal mucosa, leading to esophageal ulcers or erosions and sometimes esophageal stricture. So this is very much important cause of heartburn or peptic ulcers in the lower end of the esophagus. Now, abnormal relaxation of the lower end of esophagus, that is esophageal sphincter, is mainly due to some drugs, sometimes some food, and sometimes there is presence of hiatus hernia that causes relaxation of the lower end of the esophagus and esophageal sphincter, that causes reflux of the acid content of the stomach. But sometimes acid peptic disorder is also. Now, other causes of relaxation of the lower esophageal sphincters are obesity, drugs, alcohol, smoking, peppermint, cold drinks, chocolates. All these materials causes relaxation of the lower esophageal sphincter, which helps the reflux of the acid content in the stomach. Next, we come to the symptoms of the reflux disease, mostly in the adult. Now, what is the most common symptoms of reflux disease? This is the heartburn and sensation of regurgitation. Most common symptoms of GERD is the regurgitation and heartburn. Apart from this, there are other symptoms like excessive salivation, globus sensation, stricture and dysphagia, that is the difficulty in swallowing, and dry cough and laryngitis. These are the defined symptoms of reflux disease because of the excessive exposure of acid in the esophagus. Sometimes non-cardiac chest pain is also caused by reflux disease. Patient may come to us with severe chest pain and the cardiological evaluations remains normal. So we can stamp it as the GERD or reflux disease that lead to the non-cardiac chest pain. So this is one of the important presentation of GERD. Sometimes children and young adults can come to us with this type of symptoms like excessive vomiting or reflux of food after taking diet. So this is also one of the important presentation of GERD in the younger age groups and the infant. Now let us concentrate on how to diagnose GERD. Is it a clinical diagnosis or it is something is there for diagnosis for and documentations? Clinical diagnosis is most of the time is sufficient to stamp a case of GERD, but if we want to stamp as a definitive diagnosis, then we have to take some help of the investigation modalities. So what are the investigation modalities that we are having in our armamentarium? The number one investigation is the endoscopic examination of the gastroesophageal junction and the esophagus and the stomach. And second one important investigation is the ambulatory pH metry of the esophagus to detect whether there is any acid exposure inside the esophagus or not. And third one is the most important investigation apart from these two is the barium swallow investigation, though it is not very commonly used nowadays in the era of endoscopic examination, but this is also one of the important investigation to diagnose gastroesophageal reflux disease. Another important investigative modalities is there, that is esophageal manometry. This is also helpful for diagnosis of the esophageal pressure at the lower end of esophagus. but this is recommended only in case of where there is indications of surgical corrections of hiatus hernia, not as a routine investigation modalities as esophageal manometry. So there are three investigation. One is endoscopic examination, second one is barium investigation, and third one is the esophageal pH metry to detect the acid exposure of esophageal pH. And if there is another entity called non-acid exposure in the esophagus, that is non-acid reflux disease. In that case, esophageal impedance pH metry can also be helpful for diagnosis of GERD. Now let us concentrate how to treat and how to manage this well-known symptoms of reflux disease. This is very important aspect of treating the disease, because most of the gastroenterologist clinics are flooded with reflux disease patients. So we have to deal with the care and meticulous investigations and examinations of the patients. The most important management aspect of GERD is the lifestyle management, modification of lifestyle, because most of the patients are obese, their sedentary lifestyle is there, and their dietary habits are not very healthy. So we have to ensure that the patients should take the diet properly and to avoid the diets and the materials which are known to cause reflux disease. And also to most important aspect of managing these GERD symptoms is the lifestyle modification. This is helpful because to reduce the acid exposure in the esophagus from the stomach, we have to avoid the diets and the materials which are known to cause reflux and the decrease of the lower esophageal sphincter pressure. For example, we have to avoid alcohol, we have to avoid smoking, and avoid fatty foods, and the drugs which are known to relax the lower esophageal sphincter should be avoided as far as practicable. And apart from these, obesity is one of the important factors for reflux disease. So we have to advise the patients to reduce the weight as far as possible, and daily and regular exercise and freehand exercise, walking is also very helpful for managing this disease. Apart from these, there are some medicines are also helpful, like proton pump inhibitors, like different groups of omeprazole, pantoprazoles and esomeprazole are very much helpful to reduce the acid exposure of the esophagus. And sometimes alginic acid is also very helpful because it helps to cover up the coating the esophageal mucosa, so there is less contact of acid with the esophageal mucosa. And third one is another important is the H2 blockers. It was used previously, but nowadays in the event of appearance of omeprazole and other groups of these material drugs, role of H2 blocker has reduced too much to some extent. So, but it has also very important role to reduce the nocturnal acid breakthrough. So we can use this H2 blocker to reduce the acid exposure, particularly at the night time. So there are some medicines which reduce the acid exposure and the secretion of acid in the stomach. There are some medicines which can prevent the contact of acid with the mucosa. And third one is to reduce the nocturnal acid exposure by the use of H2 blockers. Another group of medicines are there, that is the metoclopramide or mozapride or etopride or levosulfuride. These are the groups of medicine are known as the prokinetic medicines, because it helps to augments the gastric emptying earlier, so there is less chance of acid accumulation in the stomach, and there is less chance of acid reflux. Another group of medicines are there to tackle the reflux symptoms, that is metoclopramide, levosulfurides, etoprides. And these are the prokinetic agents which helps and augments the gastric emptying, so there is less chance of acid accumulation in the stomach and less chance of acid reflux in the esophagus. So these medicines can also be helpful for managing reflux symptoms. Apart from these, there is another group of medicines, that is antacids, plain antacids or sucralfates. This is also very helpful as a coating agent apart from alginic acid that we have already discussed. So this as a coating agent, alginic acid, sucralfates and common antacids can be used as a first line of treatment for reflux symptoms to alleviate the heartburns and reagitation symptoms. So these are the medical treatments available right now for the treatment of this disease. But this is a long continued chronic treatment. It takes long time for symptom alleviation, and there is every chance of recurrence even after treatment of the disease meticulously. So arise the questions of surgical treatment, particularly in patients who are having hiatus hernia, because hiatus hernia is a disease where there is relaxation of the lower end of esophagus that leads to the excessive acid exposure of the esophagus. So there is some surgical procedures are very much common for treating this hiatus hernia, particularly Nissen's fundoperecclusion operation, which helps to reduce the sphincter diameter by encircling this esophageal sphincter. But there is chance of complications also there, so this is not routinely used nowadays, and the medical treatment is the gold standard for treatment of reflux disease. And regular checkup, regular investigation has to be done to see whether there is any occurrence of complications like esophageal ulcers, esophageal strictures or Barrett's esophagus. Barrett's esophagus is a condition where there is changes of the mucosa, that is metaplasia of the lower end of the esophagus, that can lead to adenocarcinoma development after long time of disease. So this is one of the important indications for regular endoscopic examination in patients of gastroesophageal reflux disease. So we have to determine what are the indications for doing endoscopic examination in reflux symptoms. There are some indications of definite indications for doing endoscopic examination, like if there is any bleeding, if there is any dysphagia, that is difficulty in swallowing, if there is any anemia or weight loss. In that case we have to do endoscopic examination to see whether there is any stricture formation, that is a peptic stricture, or there is any development of Barrett's esophagus and adenocarcinoma or high-grade dysplasia after doing biopsy examination. So these are the different methods which we can adopt to tackle these reflux symptoms and reflux disease. But it is a disease where we can use medical treatment as a first line of treatment. Medical treatment sometimes can be used as a diagnostic modalities, because in those patients who are having recurrent episodes of regurgitation, recurrent episodes of heartburn or globus sensation or nausea or vomiting, in that case we can use a trial of proton pump inhibitor for 4 to 6 weeks to see whether there is any response or not, particularly in those patients who do not have any red flag signs or any warning signs for development of complications. But if there is no response, in that case we can do the other modalities of treatment like endoscopic examination, barium examination or pH metry to determine the acid exposure in the esophagus. There are some special subgroups of this disease where the chance of development of reflux symptoms is much more, particularly in the case of pregnancy. In pregnancy there is increased intra-abdominal pressure, so there is increased chance of relaxation, increased chance of acid reflux in the esophagus, apart from these hormonal changes in the body. So in pregnancy, this is one of the important indications for referral to the gastroenterologist for these reflux symptoms. But what should I do? Should I do for endoscopic examination or doing other modalities of treatment? Most of the cases it is not required. Only a simple antacid or H2 blockers or proton pump inhibitor after 12 weeks of pregnancy can be used safely, because these are the medicines which has proved to be safe in pregnancy. But proton pump inhibitors is not. It's better to not use in the early pregnancy within first 12 weeks. But in the later period of the pregnancy, it can be used safely without any development of any teratogenicity. So these are the medicines, but most important thing is assurance and giving some homemade remedies like giving sucralfate, giving antacids, that can be helpful for alleviating of these reflux symptoms. And if there is any red flag signs, in that case we have to take the help of investigation and others. But most of the cases it is not required in pregnancy. And in childhood also, it is very common problem after giving feed to the infant or newborn. There is vomiting, there is reflux, but this is because of the faulty technique of feeding. Sometimes there is lack of burping, so that there is accumulation of air in the stomach, which can give rise to the reflux and the vomiting. So proper burping and proper feeding techniques can reduce the reflux symptoms and vomiting. So to summarize, the gastroesophageal reflux disease is a very common disease, and every one of us has one of our time that we experience these symptoms of reflux symptoms, heartburns or regurgitations. This is a very common problem, but sometimes they can lead to some complications, and sometimes dreaded complications which can lead to adenocarcinoma or carcinoma, and sometimes there is stricture formation which can require surgery or endoscopic management. So it is a common disease with sometimes with uncommon presentations, and treatment are very simple, that is giving some lifestyle modification, dietary exercise, dietary modifications, and sometimes reduction of weight. These are the common management aspects that it is very easy to say, but it is very difficult to follow in most of the cases. And apart from this, there are some medicines are there, like simple antacids, alginic acids, sucralfates, some proton pump inhibitors, H2 blockers, and prokinetics. These are the different forms of therapy that we can apply for reduction of symptoms and prevention of complications. And last but not the least is that if there is any red flag signs, there are new development of symptoms in patients who are chronically suffer from this reflux disease. In that case, we have to take endoscopic examination regularly, or at least once in a year, or when it is required, to detect early whether there is any Barrett's esophagus or adenocarcinoma or any stricture formation. Thank you.